My name is Charles Quang, and let's talk about a very important problem that I see every day in my office, and that's people with ovarian cancer that's not that's ovarian cancer resistant to the current chemo treatment. And I'm going to explain to you why that is. It's actually, the simplicity of it is what boggles my mind, because it's a different viewpoint. And the viewpoint comes from a nutritional herbal background, knowing what the body is capable of, versus a medical viewpoint being very focused on the cancer cells and not being able to put the cancer cells in context in the body. So I'm going to start with the basics here. So the first thing we want to know is what's going on. Well, we have a normal cell, and we have a cancer cell. And because of these two differences, we know our body promotes normal cells, but in certain cases, our body makes cancer cells. And cancer, from my viewpoint, is due to a nutritional deficiency. And the nutritional deficiency I'm talking about is very specific anti-cancer proteins that your body makes. And we know this because there's a lot of medical doctors who decided to find out for themselves what the real deal is and not follow the traditional medical route. So there's a doctor who decides to look into how to treat cancer and what the real problem is, and found out that there's a protein that our body makes that's anti-cancer. So if we were somehow to promote making your own anti-cancer proteins, your body can actually just kill the cancer cells without harming the normal cells. And that's what that doctor found out. It doesn't work all the time again, but it works better. Because when it doesn't work, you're not left disabled. And when it does work, the results are amazing. Okay. With ovarian cancer, the trick is, when any type of cancer in the ovaries, or any cysts, or you call it endometriosis, cysts, and this is all just the ovaries being encased in inflammation. Okay. We're talking about inflammation trapped inside the ovaries and it can't come out. So what we're going to look at now is what's going on in an ovarian cancer. So we'll call this ovarian cancer. In an ovarian cancer, you have your cancer cells here. And they're in a ball. And the surgeon knows this because when he goes in there, he's looking for the boundaries of that ball. So now we know what the surgeon's seeing. So what is this barrier, this ball of cancer cells? Well, the body puts it together because it doesn't want the cancer cells to come out and pollute the entire ovary. So it's trying to push it into this one area, and it creates this barrier, and this barrier prevents cancer cells from coming out. Now, when you want to inject the body with chemo, you can kind of get an idea of what's happening. This chemo can't get into this barrier. And this is very important because this barrier is made up of your own proteins. And this protein is, we call it a basement membrane. And this is why ovarian cancer is very hard to treat using chemotherapy, because chemotherapy does not penetrate these basement membrane proteins. If you were to take these cancer cells out and put them in a test tube, and we'll put this in a test tube. Get another. If we get these cancer cells out of here and put them in a test tube, and we injected chemotherapy in, chemo drugs into that, we would actually get a pretty decent success rate. But then again, if you were to get your cancer cells in a test tube only, and you put anything in there, you will get a very decent success rate. And the question becomes, what's in your chemo drug that's currently being used is another thing we're going to talk about on our next video, is the different types of chemo drugs and why we're using them currently. Okay. Now, with these chemo drugs, whatever your doctor decides to put you on, it's a very standard one because it's the strongest chemo that the doctor has in his arsenal. But now we understand that it's not how strong your chemo is accessibility. How can your chemo drug access past this barrier into this ovarian cancer cells? And so when we look at it this way, we can see why chemotherapy doesn't work as well in chemo-resistant cancers. Because chemo-resistant cancers, they have this protective barrier that the body created to encase cancer cells. And it's meant to do that because we want to keep the cancer cells contained, because they are toxic and they are polluted. So what we're going to now look at is how to look about it from a nutritional viewpoint. A nutritional viewpoint actually allows the body, so instead of using this, we're going to use nutrition, and we're going to use large amounts of proteins that your body makes, and we're going to direct that process so that your body can now start breaking apart this basement membrane. And it's something your body created, so your body can actually uncreate it. That's how easy it is. Once you open that up, you're going to be able to create an opening. In this opening, we're going to, like this, there'll be a doorway. And if we do it on the other side, we're going to open it over here. And when that happens, now your white blood cells can go in there. And this is all because of what herbs and nutrition can do. They support the body, they support the immune system, they support the lymphatic system, they support the circulation, they support enzymes, they support hormones. So we want to add more to the body to be able to create these effects. And if we do it all in concert, all at the same time, we will actually be able to create the effect that we want. And the effect that we want is, we want the white blood cells to come in. The white blood cells will come in, and they will actually go through and start breaking apart this mass of cancer cells. It's a much slower process than this, than the chemo. If the chemo drug worked, it would be a much faster process. With using the herbs and nutrition, you're using the body system. You're stimulating the immune system. You're stimulating the circulation. You're stimulating hormones and enzymes. So you're actually creating the ability to break this down. And so that gives us an idea that maybe cancer is a deficiency. A deficiency of not just one type of nutrition, but multiple types of nutrition, which increases our chances of getting cancer. And this is why you can eat hot dogs and get the cancer. You can drink Mountain Dew and get cancer. You can eat genetically modified foods and get cancer. You can get radiation and get cancer. So the different reasons why we get cancer is ultimately the ability to undo what was created. And for us to be able to undo what was created, it's the matter of using very specific nutrition and herbal protocols to help the body system to break down cancer.